Every year, hundreds of people in the U.S. die during pregnancy or just after. Yet experts note the vast majority of these deaths are preventable. In Arizona, there's a push to expand access to certified doulas to help combat these deaths, particularly among individuals of color. I took a look at what's being done to make these services more widely available.
You're not hired by the hospital, you're hired by that family. You solely work for them. And that's something that's really unique about the doula-client relationship.
Doulas don't deliver babies, but they do offer important help throughout the birth process, from educating clients about what to expect to developing a birthing plan. More importantly, they provide patients with much needed support, comfort, and advocacy.
Doulas are kind of helping to bridge that gap in communicating with your provider.
Letisa Ratliff has been a doula since 2017 and is part of a new advisory committee in Arizona. The group is exploring how the state might certify doulas, a first step toward getting these services covered under Medicaid.
I think that with Medicaid covering services, it will give more families the accessibility to doula care.
Nationally, Black women are 3 times more likely to die from a pregnancy-related cause than white women. In Arizona, women of color are also more at risk. For this reason, Stephanie Moore of Ahwatukee hired Ratliff to be her doula.
For me, it was really imperative that if I'm going to have someone advocate for me and I'm going to have people in the room, that they're going to be people who are people of color.
Research shows that having a doula can lead to better birth outcomes, including fewer C-sections and improved mental health. But the cost and a lack of knowledge around what doulas do are barriers for some.
We do our best to have sliding scales, to have payment plans in place.
The advisory committee is also working to identify training for doulas that includes culturally relevant practices.
We're all having babies. We all, deserve to have a voice and have representation from the top to the bottom.
Despite the growing demand for doulas, experts stress that the crisis surrounding Black maternal mortality is a complicated issue needing complex solutions.